Hello, everybody. How's everybody doing? Welcome in. We're going to let some people come in. I see Roel's here. D-Lin, can you see me? Can you guys see me? Edna, what's going on? Mark, what's going on? Welcome in, everybody. I expected some questions around the fenbendazole. So thank you, Mark, for taking the taking the cue there. Bianca, hello. Great to see you. Great to see everybody in here. Welcome into the Performance Medicine Show. We do this every single Tuesday at 7 p.m. Doc's going to be here shortly. I know you guys got questions. We're going to be answering questions the entire time tonight. We had some amazing questions come in through the email as well as through Instagram, Facebook. Thank you guys for contributing there. For those who don't know what Mark's talking about with fenbendazole, I'm going to go ahead and put this up here. This was the main subject of Performance Weekly that went out today, and the episode of the Common Sense MD that I'm sure you guys are probably talking about if you've watched it. That there on, I guess it's your right, is Dan Bolton. He's a PhD chemist, was on the show today with Dr. Rogers. Super, super smart guy. I've had him on Outside the Box myself about a year and a half ago, talking about his battle with throat cancer and some of the alternative treatments that he did. I will say he did traditional plus some of the alternative methods. Mark mentioned one in the comments there. So if you guys have not watched that, highly, highly suggest you guys checking that out after the show tonight. Katie, how are you? Thank you for being here. I know you guys had an unbelievably busy day today over in the Tri-City. So thank you for being with us as always tonight in the comments. Katie, we're getting requests. We've got to get you back on the show. I know you're in the show, but we're people are wanting to get you on camera again. So we'll have to get you back here shortly. Golly, as well as Robin, Amber, the whole crew. We'll have to do that again. Grandma Mary, what's going on? Great to see you. Love you. All right, we've got only emergencies. Lori, great question. Thank you. Thank you for putting that in there. We will get to that. Welcome in, everybody. We've got an unbelievable show in store for y'all tonight. Amber, how's it going? It's been a few hours since I've seen you. Amber, of course, you guys have seen in the Fountain City location. She's our nurse there, and she's also up front. So thank you, Amber, for hanging out with us this evening after being in the office all day. Happy early birthday to Isla and Ava. The twins' birthdays are coming up. Montana, what's going on? Montana, of course, is in the West Knoxville office. She's our nurse over there. So if you've been over to Franklin Square in Knoxville, you've most definitely gotten to hang out with Montana. Thank you for being with us tonight. Doc is getting ready to roll. Oh man, Jordan, I'm gonna put this up here for the crew. Man, that's awesome. Lost 45 pounds. That's incredible, Jordan. Way to go. Golly, October. What is it now? January? That's awesome. Man, congratulations. Congratulations. That's awesome. My brother Steve is in the building. Welcome in, Steve. Thank you for being with us this evening. I've got to rush through my banners because Doc is ready to roll. My man Lucas would dive into diet. Our nutrition coach Lucas Schmidt. We talked tea today. We talked tea today on YouTube. We go over black, white, green teas, their differences, how to choose between the different tea options. So definitely check in, dive into diet if you haven't already. Shout out to Lucas, who's in our Johnson City location. And I've got to put this up here for the Philosopher's House. If we have any Johnson City people in here tonight, then you might have heard of the Philosopher's House, and you might have seen some of our own. My brother Andy is a regular over at the Philosopher's House. You can see him studying and sipping on some tea. But Jesse and Jessica Shelton are amazing. Check out this podcast episode we did with them. We talked tea as well. So it's a heavy tea week. Heavy tea week. Learn all about tea, guys. All right, is Doc ready to roll? He's ready. He gave me the nod. That means we're gonna start getting ready here. What's going on, man?
Hey, Ben. Heavy tea week. I like that. Heavy tea week.
Are you drinking tea?
I drink coffee. I drink some tea. I wish I drank more.
I do too. I feel like it's.
I wish I was a philosopher. That sounds good. I wish I would be called a philosopher. It's the Philosopher House. I haven't been there yet, but I'd like to go. I'm going to go.
You know, people do not confuse you with a philosopher. I think we all can agree on that. But you do have some common sense, and you are the common sense MD. So thank you for being with us tonight, as you are every single Tuesday night, talking common sense. And how's your day, man? Before we start,
it was a great day. Saw a lot of great patients. Had a wonderful day. Several new patients and some challenging cases, and really had a good day. I always have a good day. How about you? Was your day good?
It was great. It was great. I actually work out of our Fountain City location. Got to be with Amber and Margot today, and it was rainy. So I had to. Speaking of tea and coffee, I had to consume a little extra today because of the dreariness. But because of that, you guys tonight are going to get my best. I am on fire, ready to roll. That's highly caffeinated and energized by some of these questions. And I will say, Doc, I think we need to jump into the questions because we've got a lot of them. You ready to roll?
Let's do it. Yeah, let's do it.
All right. Guys, I see Robin's in here. What's going on? Cherry, what's going on? Jordan, so good to see everybody. If you have a question for Dr. Rogers, go ahead and put that in the comments. We're going to get to live questions here shortly. We're going to start with a few questions that came in throughout the week. And let's start with, let's see. This is a question that came in around LDN and shingles. There is a little backstory. So if LDN helps suppress the shingles, how long will I need to take it? I'll give you a little backstory there, Doc. She started LDN last week and just wants a little bit more advice. 5 years ago, had surgery for an adenocarcinoma in lung and had a lobectomy. It wasn't in any lymph nodes and didn't require any cancer treatment. A few weeks before the surgery, got shingles. 6 months before this, I had a definite tick bite and treated with doxycycline. Dealt with shingles off and on 5 years, taking antivirals at different doses depending on if they had a flare. This past year, had at least 6 outbreaks, one severe on the cheek. So on LDN now, what's your thoughts on this? First of all, with LDN and shingles.
Yeah, wow. I saw a case of shingles yesterday. Well, I like LDN for a lot of things. It works and really the mechanism is kind of odd how it works. And a lot of the mechanism, I don't think they know why it works so well, but I have used it for recurrent shingles and it seems to cut down on the recurrences. It's just a great anti-inflammatory and kind of tricks your brain into releasing these endorphins. I use it for mostly autoimmune diseases. Sometimes I use it for weight loss. I used it today. I'm trying to remember the scenario that I started somebody on LDN today. It wasn't my typical LDN patient. In any event, Um, that's a good question. How long do you need to take it? If you've had 6 outbreaks in 5 years or 6 outbreaks in 1 year, if it was 6 outbreaks in 1 year, I would just take it daily for long term. And I would think about doing that anyway. I mean, it's not
It
going to
is
hurt you.
this past year has
Yeah.
had 6 outbreaks.
I would just take it indefinitely for right now. We start out at 1 milligram, work our way to 3 within a week. And after a month, I go to 4.5. Sometimes I'll go a little higher. But, with LDN, it's really outside the box. But aside from maybe having more vivid dreams, which means you're getting more REM sleep, I just don't see side effects from it. I think I've only had one person that didn't feel good on it for some other reason. I'm not sure if they got nauseated or what, but I've prescribed a lot of it through the years, and only one person felt terrible on it. And I've had a couple people that didn't like the dream, so they took it during the day instead of at night. It worked just fine. But I'd say indefinitely. And there's no guarantee that it'll work, but there's about a 50-50 chance that it will help you. But look at the other things. It's interesting. You had Lyme disease, which was appropriately treated. I'm glad you got on Doxy. Speaking of doxycycline, I did have a patient today who, as a matter of fact, is really, really improved with LDN for Sjogren's and rheumatoid arthritis, able to get off the heavy hitter medications for it. And she told me an interesting story about how doxycycline really calmed down her rheumatoid arthritis. And so sometimes I'll do that empirically for rheumatoid arthritis. I'll put somebody on doxycycline for a month, and the rheumatoid arthritis gets better, making you believe that there's an infectious etiology to rheumatoid arthritis. There's been a lot of studies going on about that very thing. So those are two good medicines to try for some of these autoimmune arthritis type rheumatologic conditions. But I would stay on LDN probably a year or more. I would definitely see how many outbreaks you have.
And it's working technically if the number of outbreaks is going down.
Hopefully that's what you hope. Some people even have to take a little suppressive dose of Valtrex or Zovirax to keep it quelled down. We do that pretty often too. But interesting, if there's any trigger that, there's always a trigger if you can figure out what the trigger is, whether it's stress, lack of sleep, foods, that type of thing. But great, I hope, but long term for right now.
And this is from the same email here. Can ivermectin help suppress shingles or after effects if there are any from the tick bite? One early test positive for Lyme and later one negative. So it seems they have tested positive for Lyme before.
I guess they were treated for Lyme with doxycycline is what I'm taking from that question. But, I really don't have a lot of experience to tell you if ivermectin helps shingles or not. Our Lyme disease, some people will use ivermectin for Lyme disease. I've seen people do it. I'm not sure that it helps a whole lot, but ivermectin is a very safe drug. Unless you have some GI upset with it, it's very safe. But I'm hesitant to tell you to try it for shingles. I think I'd go more the LDN Zovirax route, and always search for, possible triggers.
Any other advice for those who have dealt with shingles in the past? And I know you see it every once in a while. They're saying any other advice for shingles?
Yes, as soon as you break out with shingles, you need to take an antiviral like Valtrex or Zovirax.
Okay.
Or Famvir. Those are the three we use on it. They're pretty similar in efficacy. And I always, would put somebody on a really short course of prednisone when they first break out with shingles. And because you don't want to get into that post-herpetic neuralgia where you have chronic nerve irritation way after the rash goes away. And shingles sometimes recurs in the same area. It'll pop out on somebody's, side at the same place, or their buttocks or somewhere. It'll just pop out every once in a while for no reason. Shingles, it hides in those. It's a chickenpox virus, and then it never really goes out of your body. It kind of hides in a nerve root and can come out later in the form of a shingles rash. It's painful. It can cause scarring. It can cause neuropathy or chronic pain. I've seen some awful cases of shingles.
Yeah.
Especially if it gets on your face, on the tip of your nose, into your eye. It's really serious. I've had quite a few discussions with ophthalmologists about how to treat it in your eye. As a matter of fact, I've treated 2 cases in the eye this year. Or because of, the virus that's been going around for the last 3 years, I think we're seeing a lot more shingles.
Well, I hope that helps. For anyone who's dealing with or who has dealt with shingles. Hope that answer helps you. We're going to move on here. This is an interstitial lung disease question. Question is, any tips for dealing with interstitial lung disease? Any helpful supplements or diets that you can think of? What's your thoughts on this?
Interstitial lung disease is kind of an odd bird, really. Unlike asthma or COPD, emphysema, that type of thing. It's really an inflammatory condition of the interstitium. What I mean by that is interstitium is really like connective tissue. In the case of lung, it's a connective tissue between the blood cells and the air sacs, the alveoli. And so you have connective tissue, and with interstitial lung disease, that tissue gets inflamed and it scars your lungs up. When you think of that term, what I think about is asbestosis is an interstitial lung disease. And then there's idiopathic pulmonary fibrosis, which is the worst one. And, it can be a fatal disease if it's that. I think the diagnosis is usually made by CAT scan. And of course, you're going to be seeing a pulmonologist. But they treat it with a lot of different things. The pulmonologists do. They usually treat with immunosuppressive drugs. Trying to recall some of them that I've had patients treated with. Cellcept, Cytoxan, Imuran, those type of immunosuppressants. Those are heavy hitters. They just suppress your immune system so that, it's almost like an overreaction of your immune system. And it causes scarring. And, I suspect that we're going to see a lot of that from COVID lung. I'm betting that we're going to see a lot of that that's precipitated by the COVID virus. It's a bad deal. Usually it can get real progressive quickly, or it can have relapses too. Sometimes you see patients that kind of do well for a year or two, then relapse. And if it gets really progressive and nothing works for it, it can be a fatal disease within 3 years. But there's a lot of controversy on how to treat it. Of course, prednisone, is one of the mainstays of treatment for most lung diseases, that one included. What I would do is, and I have used it once or twice, I like LDN for that. It's certainly worth a try. It's not going to hurt. So if you're not having luck with the other medicines, especially prednisone or the heavy hitters, then you might try LDN. And I always put people like that on more of an autoimmune diet. Look at their gut, talk about their gut, make sure they stay away from inflammatory foods because it's inflammation. Kind of like interstitial cystitis, which is another bladder, painful, long-standing, recurrent bladder condition, seen mostly in females, but an autoimmune diet. So and make sure the gut's balanced and you stay away from sugars and dairy and glutens and nightshades and corn, that type of thing. So if you're not getting anywhere with that, you might look into some of the alternative treatments, especially LDN.
That's a great question. Great answer there. Thank you, Doc. And thank you for sending that question in through email. Carter, I see you. It was so good seeing you last week in the Johnson City office. So good see you here every week, but so good to see you in person. Last week, let's see, I see Lisa shared. Thank you so much. Welcome in, Roel. We got a great crowd here tonight, Doc. We got a great crowd.
Great. I love these guys that come on here. They're all smarter than me. So, I don't know why they tune into me.
Well, we have a blast. I see Jack's in here. Jack, thank you for hanging out. Like we say every week, we learn as much from these comments. I see Mark is talking with Roel on YouTube as you guys learn from the answers here. So thank you guys so much for interacting. And so, and if you're with us live, look at the comments, follow the comments there, because a lot of great insight from the community here. Katie, I don't know how to answer that question. You guys, I love you both.
Why don't you ask if you like Carter or Katie better?
My favorite twin.
They're twins. Yeah. It's hard to know.
I love you both. I love you both. I'm so glad you guys are in here tonight, and you're in here every single week. It makes this so much fun. So thank you. Remember,
it's not a competition.
All right, let's keep going here. This is a question about old therapy. How much is old therapy, say, for the full face? And Katie, you can correct me if I'm wrong. I shot a text to Kelly, our esthetician in the Johnson City office, and I believe it is $2,500. And Katie, Katie or Carter can tell me if I'm wrong there. Doc, why don't you tell everybody what old therapy is? I kind of think of it as an alternative for a facelift.
I hope you don't flash my before and after when I got it a couple of years ago.
Man, we should have that.
I do show a lot of people that picture, but
that is crazy.
That. But I did have it when we first bought that machine. Very expensive machine 2 years ago. It's, to me, in my mind, it's the best one we have as far as, making your face look better, for tightening everything up. It's pretty amazing what it does, and it's usually one session. It gets hot, but it's tolerable for sure. I just took a Motrin, but yeah, it works through really deep ultrasound. That's why they call it old therapy. But most of your Hollywood stars that look good use this thing, and they probably even buy their own machines because they're expensive. But it's just a great way to kind of rejuvenate a face that's kind of aging like mine. But if you ever want to see the before and after on me after one treatment, it's pretty good. I probably need another. That's been at least 2.5 years. It takes about an hour and a half. I'm not even sure Kelly did the full face on me.
This is courtesy of Katie. This was a quick text, and we'll probably get it up here on the big screen. Can you guys see that? So obviously, if you're looking at this, I guess that's your right. That's the after, and then the before is the left. We'll get that up here.
It just tightens everything up.
And it looks like it's post 8 weeks.
Is that right? That's probably about right. That was 2 years ago, so probably need another one. But
That's wild.
I think at least
Thank
lasts
you
at
for
least
that,
two
Katie.
years. Yeah,
Well,
thank you, Katie, for embarrassing me like that. But that's what oil therapy is. I think Christy Brinkley and J Lo, they all use that. The people
yeah.
look great for their age, I guess. But
All right. Let's go to let's see. Let's get to as a saffron question. My saffron just arrived. Can I take it at lunch with my other 9 supplements? It seems that they are taking all their supplements at lunch, everything except magnesium. Magnesium at night.
yeah, I mean, it's not going to hurt. It's not going to interfere with anything. Certainly, you can.
Okay.
Saffron's one of my favorite supplements. I bet I put 5 people on it today. I use it for weight loss. I use it for anxiety. I use it for depression. It's just, it helps prevent cravings. It's just a great supplement. It's really a spice, but I do like saffron a lot.
You know what? This question kind of goes with that last saffron question. And I love it because I know, we talk a lot about supplements on this show. We got a lot of vitamin takers in here. And this is a question around like how to take a lot of them. So the question is there someone at one of your offices that could work with my husband and myself with all the supplements / vitamins we currently take? I know some of the Dr. Rogers supplements help to combine things, but at present we are taking maybe 40 plus capsules daily. The question is, I want us to take everything that would be beneficial, but we'd love to cut out some or combine some if it would provide the same strength and quality. And I think this question is one that a lot of people are thinking.
Yeah, I mean, that's what I did. That's certainly
Yeah.
what I did. That's why I got my own vitamins, because I was taking too many. I was taking up around what you're taking, and I wanted to just kind of. In one way, I liked it because it made me drink more water, but then it got cumbersome because I'm taking. I split mine up at 2 or 3 different times during the day. Of course, I take magnesium at night, and I take my aspirin at night as well. I think that's the best time to take your 81 milligram aspirin if you take that. But yeah, I mean, you should come by and look at and show us what you're taking. Any but one of us will help you. Just bring them in and we'll show you what's on the. Really, you ought to just kind of or send them a link to what's in the Dr. Rogers Super Vitamin, because it's got a lot of stuff in it that really prevented me from having to take,
What
my
did you
fishing
get?
tackle.
I'll put up the energy complex here. See if it. So okay, so this is your CoQ10 and your PQQ. So
Yeah, that's just energy, but my multivitamin has a ton of stuff in it, and that's my the other one I have is the immune formula, and then I have the super vitamin, which is the one that we have a hard time keeping in. But I mean, that's fine print, but 5,000 D with K, enough C. It's got the gamma E in it. It's got the methylated B complex. It's got the boron, the manganese. It even has lycopene in it. You can read in here. It has 50 or 30 milligram of zinc. So the basic is that super vitamin formula is probably will take a lot out of it. And again, the energy formula I separated because I wanted PQQ in with my CoQ10, and I was able to order enough so that formula is actually cheaper than taking CoQ10 alone. And really, you need PQQ in with CoQ10. CoQ10 makes your mitochondria release more ATP, but PQQ creates more mitochondria. And it's all about the mitochondria, really. That new book that I'm reading about the brain energy that you got me is fantastic. And it boils down to your metabolism via your mitochondria in every cell. But come in and, we tried it. That's exactly why I formulated those vitamins. I finally found a pharmacy out in Portland, Oregon that would make them for me. And they did say that was the most packed multi they'd ever made. So I like it. So come check it out, and it's really useful.
I had to let her sit there just a little bit, just to, I wanted her to see
She
what
looked
she just
shocked that
did.
she was in there. Yeah, she's trying to follow the podcast, but she got in on it somehow.
No, I saw what was happening. I was like, oh, she's coming in here. All right, here we go. Here we go. Hello, Mom. It's such a great question, and I'm glad that came in. And they did mention in the email, our nutrition coach, Lucas Schmidt, does a lot of this as well. His focus is on, diets, but supplements are a part of that. And, I know he does some counseling around.
Lucas knows supplements as well as anybody I've been around.
And Carter, is Lucas doing any vitamin counseling as well, or just mainly kind of nutrition? I know he also builds in, some of the training stuff. I think we might have like a Lucas menu in here somewhere. We'll see. We're going to move on, and we'll talk more about that, because I know it's a lot of people are thinking the same thing. How can we kind of cut that down a little bit? I know there's a kind of a base that you need to stay on. Oh, there we go. There we go. That's what Mom was doing.
Zoom in on that. Take that
All
back
right.
down. That's kind of embarrassing. Definitely help saggy skin.
There's a little old therapy. What do they call that?
Take it off, Ben. What do they call it? What do you mean?
That pose, is it like where you're to the side? Portrait? Is that a portrait?
I don't know. It's just a side view. I don't know.
A side view? Well, you look great. You look great. Like we said last week, you recently turned 68, and you make that look like you're darn 35,
that
man.
First picture looked pretty old, saggy skin. That old therapy is great. It's the best machine we have, I think, by far. We've got all these ton of lasers. People that want to age good, my job's to metabolically, hormonally help them, supplements, nutrition. But Kelly has some things that can really take years off your face, because everybody looks at your face, that's what people look at. And that's, so there's nothing bad about getting a small little hour-long procedure that really can help you for a long time.
And I want to give a shout out to my sister Kelly, who's our esthetician in Johnson City. They are doing this next week, a little lips, hips, and sips. I don't think there's an old therapy special, but there's a lot of other things. So if this is something that's interesting to you guys, give Kelly a shout. Shout out to Kelly Rogers, who's going to be heading this up, along with, we got Emily Curitan in Kingsport. We've got Jasmine Allman in Fountain City. Shout out to all the estheticians at Performance Medicine. All right, let's get back to it here. How am I going to get back to the question I was on? Let's do this. What's the best vitamins to take to improve memory?
The one I take is Cognitex. It's made by Life Extension. Has phosphatidylcholine, phosphatidylserine. What's that other magic ingredient in that? I forget, but I like that. There's another one that I like called Protandim, and that has, the thing in there that I like about that one is it has Bacopa in there. That's always on everybody's hit list for memory. These things work, I think, better than the ones you see on TV, like Prevnar and some of those. Ginkgo is probably pretty good for it, but I really like those two, the Cognitex and the Protandim. And remember, look at your hormones, testosterone especially, it's a memory hormone. And do all the other stuff that you need to be doing. Make sure, remember, take your fat-soluble vitamins, your omegas. Your brain's mostly made of water and fat, so that your brain needs good fat. So don't get your cholesterol too low. If you don't need a statin, please don't take one, because there's been a lot of links to dementia with that, because your brain, your cells are made of cholesterol. You don't want to get your cholesterol too low. the fat that you need won't be there, and your cells, especially your brain cells, will degenerate quicker.
Mm.
So do not try to rock bottom your cholesterol. I mean, I see people sometimes with a natural cholesterol. I saw one last week. Their cholesterol was 92. Their total cholesterol was 92. Not on any medicines. And they were going, this is great. Wow. I don't think it's so good, really.
Mm.
You need some cholesterol. I don't like to see it below 140.
Interesting. I didn't know that.
I don't put a lot of people on statins. Few, but not a lot.
Super interesting. This is a question we get often. Hormonal acne solutions. I'm assuming this is from a patient who is on some sort of hormone therapy. What's your thoughts on this?
I don't know if you take that as somebody who's on hormonal therapy or if hormones can be a cure for acne, which both are true. Of course, if you're a teenager, a lot of times, teenage girl, they'll put you on birth control pills, and some of them do calm it down a little bit. And those are synthetic hormones, but as you know, I prefer bioidentical. So sometimes I'll cycle progesterone in there a little bit in the last half of the cycle. Seems to help a little bit. You always look at diet too. I mean, acne a lot of times is dietary related. You can really clear it up by a really clean diet and balancing your gut microbiome. But if you're talking about if you are having acne because you're taking hormones like testosterone or DHEA, those are the two that could cause it, then certainly you can block down the DHT. Testosterone either converts to dihydrotestosterone or estradiol. So if it's converting too much to DHT, you could certainly get a little acne with it, and we'll block it down a little bit with spironolactone, which is a diuretic. Sometimes we use herbs like saw palmetto, pumpkin seed, stinging nettle, things like that. But I'm trying to think and DHEA, sometimes we'll just cut it out and not use it. And that can cause hair loss in some women also. So you got to look at that a little bit closer. So yeah, get your hormones checked, and there's certainly some ways we can deal with that.
No, it's a great question, and I know a lot of people are thinking or dealing with the same thing. So thank you for putting that on
PCOS, is a polycystic ovarian disease or syndrome, and that's a hormonal thing where you get hair growth and acne. A lot of times we'll block it down with metformin or berberine or spironolactone.
Yeah.
Low carb diet, cut out sugar.
All right, guys. That's going to do it for the questions that came in throughout the week. Thank you to all those who sent in a question via email or via Instagram or Facebook. Thank you so much for doing that. I'm seeing Pop, it's profile. That was a profile pic or a mugshot.
Mugshot. Right. Let's call it a mugshot.
Or a cameo. I'm seeing cameo as well. Okay, guys, we've got some great questions here. Go ahead and put your question in for Doc. We're going to keep it moving here. You ready to go for the live questions?
Sure.
All right. Let's see here. I'm just going to put this up for Mark. Everybody should watch that podcast. Totally agree on fenbendazole. Artemisinin was talked quite extensively about. So thank you, Mark, for putting that in there.
Thanks, Mark. I hope you're doing well. Yeah, that's an amazing podcast with Dr. Dan Bolton on there. I really enjoyed talking to him and being a good friend. And he's just a super smart guy. And, if you're dealing with cancer or somebody that is, please tune into that podcast today.
Yeah.
Because there's a lot of choices that you need to make if you're faced with that. And I'm of the attitude that you need to do the traditional things. For example, if you have a solid tumor, you got to cut it out. And chemo sometimes may be needed. But there's also some alternative treatments you can add on to that, especially if you can't tolerate certain chemo or radiation type deals. And there's a lot of times there's choices, but certainly some of these add-ons we talked about, like fenbendazole, seem to be pretty effective, and they're very safe, and they're dirt cheap.
Yeah.
But go to see Dan's podcast. You did one with him a couple of years ago. This is kind of a follow-up, but just a super interesting podcast with Dan. He's really given some good advice to patients through the years that he dealt with this, and has seen some just amazing recoveries from cancer.
Let's start here with Edna's question on YouTube. I had 3 rooster comb shots in my knee. With each shot, my pain increased. Ortho doctor said give it time. Been 2 weeks since I had the 3rd shot. The pain in my knee and down my leg is unbearable. And I don't know, am I missing a question there, Edna? It seems that we're just looking for thoughts on this. Anything?
What to do? Yeah. A lot of times the Synovisc or rooster comb, there's some different brands out now, help, kind of generate a little bit of cushion in there in your knee. If it's bone on bone, it's not going to work too good, in my opinion. So a lot of it depends on how bad that your situation on the knee is. Certainly, I prefer PRP. I think it works as good or probably better than the rooster comb. A lot of ortho guys are realizing that now too. The rooster comb will probably be covered by your insurance. The PRP, platelet-rich plasma, won't be. It's I think it's about $500 for a shot. But I know I had both my knees injected with a PRP, and it was just amazing what it did for my knees. I've talked about it before. I've even showed you. I think you put something up on a post or something about how I can sit back on my heels and lean all the way back. I couldn't even come close to doing that before PRP.
Yeah.
And it didn't hurt, Some people say you get pretty sore right after PRP, but I certainly didn't. A lot of times I think it's the spinner, the centrifuge that you use, whether they take the white blood cells out of it or not. But that's not too typical.
So the question is it normal or a bad reaction?
It sounds like it's not normal to me. I mean, you shouldn't be having that much pain.
Okay.
It'd be interesting. So after the first 2, it didn't bother you that much. This one, it did. I don't know. Maybe they hit a nerve, or, anytime you stick a needle anywhere, you could potentially hit a nerve or a vessel and cause some bleeding or irritation around the nerve. But certainly I think it'll get better. And it does take a while to really start regenerating cartilage and providing cushion. But I would definitely be taking some anti-inflammatories and icing it down if it was me. If it's that bad, don't worry about getting the good inflammatory effects from it. If you're having that much pain, something's kind of off kilter a little bit. So make sure you followed up with the doctor who injected, and do those things in the meantime with taking Motrin or Aleve and using ice. You may even try rubbing some CBD on it, which I think will help, or even taking it orally as well.
Thank you for putting that in there, Ed. I hope that gets better. Keep us posted here on the show. Let's get to Lori's question here on Facebook. My dad is 86, keeps getting UTIs. Am I wrong? UTIs. Okay, yeah. Sorry. Keeps getting UTIs, completes antibiotics, but the infection comes right back. I'm afraid he's getting immune to the antibiotics. He just finished cefepime 8 days ago, and infection is back. How do you feel about D-mannose? He has AFib and takes Eliquis. Any recommendations? Sorry if I mispronounced anything there.
Yeah. I like D-mannose. It's kind of a natural sugar, but it seems to help infections. It stems off inflammation. Um, Believe it or not, I like it in diabetics, but um, he must have a reason. I don't know if he's had to have a catheter in the past or why he keeps getting those infections. I assume he's seen a urologist and maybe they took a peek in his bladder to see, you know, if he might not have, this chronic interstitial cystitis pattern. But here's the thing I would definitely think about trying. If you want to try D-mannose, fine. It's not going to hurt him, but I'd try some methylene blue.
Hmm.
You can get over the counter food grade methylene blue. We have it in all our offices. I love it. I treat a lot of long COVID
You,
with
you
it.
mean pharmaceutical grade? Pharmaceutical or food
Yeah,
grade?
yeah, it's over the counter though.
Okay.
Yeah, pharmaceutical grade, food grade.
Okay.
But put 8 drops in an 8-ounce glass of water and drink it every day. It's got great preventive effects for UTIs. And make sure he's drinking not a lot of water, and he's not um, uh, you know, drinking a lot of sugary drinks or anything like that. Hopefully, he's not on any medicines that could cause some of that irritation, like some of the diabetic medications can do that. So it could be something that's predisposing. But I agree, you need to do a culture of the urine and see if it is a true infection and what the sensitivities are to the various antibiotics that he's been treated with. They may have an unusual bug in there. It needs to be looked at. So make sure you get a culture and cranberry peels. I like those, Jack. Those are good. May help a little bit. But get you some methylene blue. Do that tomorrow.
All
It
right.
also
Thank you.
helps. It helps dementia as well.
All right. Thank you for that question, Lori. We're going to get to Roel's question. Doc, I have a two-part question. Do you recommend any supplement for gallbladder? On your latest podcast, you mentioned that we don't want to mess up our immune system. How does someone mess it up? So let's start with the gallbladder question, and then go into the immune system question.
I always like milk thistle for liver, gallbladder, and I like digestive enzymes like you find in Digest Shield, our favorite gut product of all time. But so I like digestive enzymes. If your gallbladder is malfunctioning, there's some things you can do for it. I'm blanking out on the one that is supposed to dissolve deoxycholic acid. I believe it may dissolve stones. It doesn't work all the time, but definitely milk thistle and digestive enzymes are my two. And avoiding foods that irritate your gallbladder. I had a patient today that had their gallbladder out years ago, and it kind of precipitated a lot of gut problems, a lot of IBSD on them. I put them on Digest Shield. I know they'll get better with that. And certain foods may need to be avoided also, like certain fatty, greasy meals. Certainly look at that. But I mentioned you don't want to mess up. I forgot
Immune
if I was
system.
talking. Was that the podcast on cancer?
Yeah, you just talked about the importance of keeping your immune system strong.
Yeah.
How just protecting that immune system.
Yeah. The main thing I think about is gut when I
Yeah.
think about that is protecting your gut. Because if your immune system's 80% of it's in your gut, and if you eat inflammatory foods or ones that you're sensitive to, and you develop those gaps in the tight junctions of your gut lining, you get leaky gut, and you get things that come in your bloodstream that shouldn't be in your bloodstream. They should be eliminated through your GI system, and then it sparks off these inflammatory reactions and therefore autoimmune diseases. But there's other ways to mess up your immune system. Through certain medications can do it. Overuse of antibiotics. lack of sleep, chronic stress. You know, you got to look at that cortisol, insulin, thyroid axis to have that balanced out. So all those things contribute to your immune system. I mean, God gave us a great immune system. We should be able to fight these types of infections off with our helper T cells and all this stuff, and natural killer cells and things. I mean, we're equipped for our immune system to fight off almost anything. But if you get obese, if you eat junk food all day, if you're not sleeping, if you're stressed out, you're not going to have a good immune system. And those people that died of COVID usually had compromised immune systems. A lot of obesity, a lot of low vitamin Ds. Another good way to take care of your immune system is to take vitamin D.
Yeah.
You know, and probably some other things too, like NAC and quercetin and zinc. But great question. You can certainly mess it up in a lot of ways, but think gut.
Thank you for that, Roel. Let's get to Bianca here on Facebook. Thoughts on methylprednisone pack for arthritis in a shoulder?
Yeah, I mean, you know, we use steroid dose packs for a lot of conditions, including, you know, acute inflammatory situations like if it's bursitis in the shoulder. I don't think I would do it for chronic arthritis. Definitely, I would not use that for any chronic arthritis. But if it's an acute bursitis, or you just need to calm it down from an injury, it's a thought. Of course, we use steroid dose packs for other things too, like sunburn, severe sunburn, poison ivy, poison oak, allergic reactions. But the dose packs, even a low dose pack can have its drawbacks. I really think that when I went through my gut problems, I think it was really because of a combination of being on a dose pack and an antibiotic and having COVID. Mm-hmm. It really is like a perfect storm for me. It messed my gut up for 4 months, as you know.
Yeah.
So be careful with it. So if it's, obviously it works. Prednisone is a miracle drug, and then it can be the devil as well, because for acute situations, it's perfect. Flare up of asthma, something like that, it's great. But if you don't have a pretty good reason for using it, I wouldn't, because it's going to raise your blood sugars. It's going to cause salt retention and weight gain. You're not going to sleep well while you're on it. It just has some drawbacks. For acute uses, it works fine. And I've certainly taken them in the past too. Matter of fact, I think most travel kits ought to include a dose pack, for situations where you can't get to a doctor. You may need it. It certainly works, but be careful. It's kind of like taking a quinolone for an antibiotic that kills most of the bugs, the bacteria, but don't use it unless you have to, because it can cause some pretty severe tendonitis, and it can kick off some things that we call it being floxed. It can kick off some things that down the road that's not good. So be careful with them. Don't take them unless there's a pretty darn good reason. It's going to help, but if it's a chronic situation, don't do it. I'd much rather, if you have arthritis in the shoulder or bursitis, I'd much rather just pop a shot of Celestone in there, or Decadron, right into the joint itself, rather than take it orally, where it could mess your gut up, and you don't need it for your whole system in that case. If it's just for one part, I much prefer the injections to that. But great question.
Makes a lot of sense. Bianca, thank you so much for that. I've never heard you talk about prednisone that way. I like that. Let's get to Steve here. I have a friend who had a gout attack a few days ago. He has very bad pain in one of his feet. I read that the microbiome is responsible for removing upwards of 1/3 of the uric acid in the blood. Would you recommend probiotic supplementation to help with that? What else do you recommend?
Yeah, definitely would get on a probiotic. But yeah, gout's a toughie. you need a baseline uric acid level to see. And then for people that are predisposed to that, they need to be careful about what precipitates it, like maybe red meat or shellfish or alcohol. Those, did I say red meat? Or either starvation or overeating can kick a gouty episode off for those people that are predisposed to it. But certainly, you're going to need to take a probiotic anyway. And if you got to take one, take DigestShield, of course, because it has the prebiotics and digestive enzymes, other things you need to help, kind of cleanse the gut. Because if you're having gas and bloating all the time, you're not helping your gut. So you got to hit it from a lot of different angles. And, you certainly block down the dairy and the glutens in there that could tip it off as well. I haven't seen any studies as far as what your baseline uric acid is before and after. But that'd be an interesting thing to look at. But those things, and that's a place I would definitely use about 3 days of prednisone as a gout attack. We like to use Indocin, which is a really potent anti-inflammatory. But you got to be careful with your gut, because you're right, that can screw your gut up. And then so can prednisone. So I would take some DigestShield with it. I wouldn't wait till after. I would take it with it. But gout can be tough. Sometimes we have to use colchicine, which is pretty useful anti-inflammatory, with uses, a lot of different off-label uses for COVID as well. A lot of people use it for that.
Steve, thank you for that question there. Let's keep going. Let's go to Barbara here on YouTube. What should I do for cholesterol? You've talked a little bit about cholesterol tonight. I'm assuming this means lowering it. What's your thoughts?
Well, again, don't freak out just because your cholesterol may be elevated. Elevated cholesterol by itself does not cause heart disease. As I said before, you need cholesterol. It's an essential type of fat that you need, especially for your brain and for every cell wall in your body. So it just depends on, and again, a total cholesterol doesn't mean anything. That's almost a worthless test. It really is a worthless test, unless you're checking for the other stuff, and not just the HDL and LDL, good and bad. You need to look at the particle size. You need to look at the ApoB, which represents all the small particles of your LDL, VLDL, chylomicrons, all that. And you need to look at your triglycerides. That's probably a more important factor than your cholesterol. You need to look at your LP little a. You need to look at your how oxidized your LDL is. You need to look at your CRP and your myeloperoxidase. In short, come in and get a Cleveland panel, and we'll look at it and see. Most of the time when I look at them, you don't need a statin for your cholesterol. But if you want to go natural and you need something, today I put somebody on garlic pills for it. Put another person on hawthorn. I like both those. Kind of like sometimes I'll use berberine instead of metformin for some people. So look at you got to get a more definitive answer on your cholesterol, because total cholesterol doesn't mean a lot. There's other options too. If it's really high and it needs to come down, if your coronary calcium score is high and you have known plaque, heart disease, and you're diabetic and you have all these risk factors, then sometimes I will use, occasionally I even use a really low dose Crestor, which is a statin, to have it on board. But a lot of times I use Cholesterol for it. There can be some, a lot of it depends on whether if your liver is cranking out too much cholesterol or you're just over absorbing it. So there's different medications for both. Of course, the statin prevents the output from your liver of cholesterol. So it's complex. So don't just think, hey, my doctor said my cholesterol is 230. I need a medicine for it. No, don't take that for an answer. Look into it further. Get a Cleveland heart panel and talk with somebody who knows how to interpret it.
Mm.
You know, it's funny. I've always I love the story. I told it today. I did a Cleveland heart panel on one of my patients a couple of years ago, and it happened to be a patient who had heart disease. He had a couple stents. So after I went over it with him, I said, "You still seeing your cardiologist once a year?" And he goes, "Yeah, as a matter of fact, I see him next week." And I go, "Well, take this Cleveland heart panel in, and so he won't have to draw any blood. He can just use this. It's fresh. And, it's got a lot of information on it. Just take that, and that way you don't have to do any more blood work." So I saw him back about a month later for something else, and I said, "Well, how'd your cardiology visit go?" And he goes, "I'm never going back to that guy again." And I go, "What happened?" And he goes, "Well, I took the Cleveland heart panel in there, which, by the way, comes from the foremost heart center in the world. See, I took that Cleveland panel, and he took one look at it and says, 'This is BS,' and throws it in the garbage can." And it's funny because I'll laugh my head off. So that guy lost a good patient, and he was an idiot because he did that. I mean, you never do that to a patient. Plus, I was talking with another cardiology buddy who's actually a big dog cardiologist in charge of thousands of cardiologists. And I told him that story, and we both laughed. He laughed too, and I said, "Why do you think he did that?" And he says, "Because he didn't know how to interpret it."
Mm.
So I thought that was funny.
All right, Barbara, thank you so much for that question. We need to move on here because I want to get to as many as possible. Great questions are coming in. Thank you guys so much. Thank you for hanging out with us tonight. This is from Chuck. Is the Life Extension extended release magnesium enough to cover all magnesium requirements?
Several different ones. I'm not sure which one you're talking about. I'm pretty sure the one you're talking about is the 500 milligram magnesium that has succinate, citrate, and oxide in it. It has 3 in it. That's a really good one. I like the Neuromag. It's the one I take myself. Maybe it's because I'm old and I don't want that magnesium threonate in there. But there's just so many there's 9 different forms of magnesium. You might want to even refer back to a podcast that I did on it, but it's probably enough to cover, what you're looking at it for. It's certainly a really good form of magnesium. Some people get specific, maybe unnecessarily so, with the different forms like magnesium malate, if they tend to have a lot of joint pain and things and maybe cramping. And there's all kinds there's magnesium taurate that some people like for that same reason. There's magnesium glycinate, which is more for brain function. But that is a good one. I like it. Certainly almost every adult should take magnesium. It should help you sleep. It prevents cardiac arrhythmias, helps your bowel movements. These are three main reasons that you'd use it. But I like it too for brain. I like it for cramping. I think it's just a wonderful supplement to take. I don't know if any supplement has all 9 in it, but certainly if you get too much magnesium, you're going to have diarrhea. So if you're taking too much, you get diarrhea back down a little bit.
And I'll add, Chuck, you might have already seen the episode with Robin on magnesium, but we didn't explain this episode where she goes over all the different types of magnesium and, what you would take that type of magnesium for. You might have already seen it, but if you haven't, then definitely check that out. Okay, real quick, Barbara's asking, will saffron cause heart palpitations? Have you seen that?
I don't think I've ever seen that. I'm trying to remember. I might maybe have one person that did not like taking saffron. It shouldn't. If it does, they're going to be benign, but if it bothers you, stop it. Remember, never start 2 supplements the same time within a few days. and see, if obviously if you start taking it, you get a lot of PVCs or heart palpitations. You stop it, it goes away. Probably caused it, but I don't know why it would.
All right. We got Barbara Floyd here on Facebook saying, what's PQQ? This is in reference to one of the supplements you talk a lot about with energy. How would you describe PQQ? We're going to go
Pure
through
quinol. I don't even think I can pronounce it. It's a big, long chemical name, but it is a natural supplement that kind of promotes your cells to produce more mitochondria. So it works kind of in conjunction with CoQ10, which makes your mitochondria pump out more ATP, adenosine triphosphate, which is a source of all energy. So if you take both of them, which is in my energy formula, you should feel better, especially if you're tired.
All right. Thank you for that, Barbara. Let's get to Tori here on Facebook. Once you feel a cold coming on, what's the best thing to take in defense? I know you have kind of a go-to. What's your go-to when you're starting to feel a cold coming on?
Hey, Tori. Of course, I love zinc. You can even chew on some zinc lozenges, especially if you have a sore throat. So I love zinc, and I really like vitamin D and vitamin C. Immediately if you get a sore throat or you're getting a cold or you're getting sick, I'd immediately pop 50,000 of D3 a day for 5 days. And you could even pop a vitamin C, 1,000 milligrams, 1 gram every hour until you felt better. I'll at least go 4,000 a day on the vitamin C and 50 of zinc. Those are my top ones. And then also, I like that Cofix spray that we have in our offices. It's kind of like an iodine type thing. You spray up your nose and in your throat. When it first comes on, when I do that, boom, it's gone. Some people use silver nitrate, colloidal silver, not silver nitrate, for the same purpose. But those are the things I do. So have it on hand in case you start to come down with something.
All right. Don and Steve is asking, what is the best supplement to lower my cholesterol? Mine is 242. And also, do y'all eat sushi? I know you eat sushi. What's your thoughts on this?
Yeah, I like sushi. I don't eat it a lot, but if I go to a really good place like Nama's in Knoxville, I love that place. As long as it's legitimate, certainly raw fish, you gotta be careful where you get it. But I've not had any problem with it. And I prefer the shrimp tempura. I really like the stuff that's cooked a little bit better anyway. But the best supplement to lower your cholesterol, there's a couple I like, and I mentioned them earlier. I really like garlic tablets, and I like hawthorn a lot. Those are two of my favorites.
All right. Thank you, Don and Steve. Lisa's asking, what milligram of berberine should females take with PCOS take?
Man, I'd have to look up on my bottle.
And
if you have PCOS, Katie might have it on the Life Extension bottle, but I know it says once a day, but for PCOS, you can certainly pop it up to twice a day. I've found that if you take a ton of berberine, it may give you a little stomach upset, kind of like metformin does. If it does, you're taking too much of it, but very similar actions to it. But I'll have to get Katie to flip. Okay, 510. Okay.
Thank you for that, Katie. 510 milligrams of berberine for Lisa there. Thank you, Lisa, for that question. Sorry, guys, if I'm moving fast. I just don't want to leave anybody hanging. Hello, Ace Performance Picks. What's going on, man?
Man, I got to tell you what. I let one of my buddies borrow that big, thick pick you made me.
Yeah.
I mean, this thing's unbelievable. I've showed it to you, Ben.
Yeah.
And he
unbelievable.
Loved it.
Yeah.
I mean, he picked on my 63 Gibson that I just picked up a few weeks ago, 1963 Gibson J50, which is an incredibly good, nice vintage guitar with great sound. But he loved it. By the way, but some of those picks are just amazing that you make. And I've gone to a pick that I like the ones that don't. They're triangular, so each triangle is exact same. So if I get it messed around on my finger, I don't have to look and get it exactly right. It just slides right over. And I'm kind of going with more of the heavier picks than I used to, since you kind of turned me on to, that your Teflon stuff. But just if you have any guitar players out here listening to me, go to his site. It's just amazing. Makes them all right here in East Tennessee. So
pretty
cool.
Incredible. That is so cool. Thank you, Ace, for I know Ace Performance Picks. Thank you for being here. What's your thoughts on the question here? Do you have any experience with home hematocrit testers?
No, I don't. I really don't. I don't know how accurate they are. It'd be a nice thing to have. Certainly. We have a hemoglobin A1C machine in our office where we can check an A1C in about 10 minutes. But I don't know. I don't know how much they cost or anything. I'm going to look into that. I really am, because really I could use one. I know the blood banks can prick your finger right there and tell you. I just don't know how accurate they are and if they reflect state of hydration and that type of thing. But I'm gonna put that. I'm gonna do some research. If Katie's listening, put that on my list, Katie, for me to look up and see, because that'd be a nice thing to have. Hey, I just did.
There you go.
Pick. See, I love it. It's all equal. It's nice.
There's an Ace Performance pick. I love it.
And here is my. Look at that. The thing's in good shape. It's 1963. See? Doesn't that sound good? I'm just gonna strum. I'm not gonna play, Ben. Let's just strum one chord. Doesn't that sound good?
That sounds so good.
Great guitar. Great pick. Ace Performance Picks.
I love it. I
can't drop this thing. This thing's expensive. I cannot drop it.
All right, we're going to get to just a few more questions here, guys. Let's see, who am I missing? If I missed you, I promise you we will comment back and answer. Let's see here. And we'll go ahead and get Ike's on his way down. I've seen, let's see, where am I at? Let's get one more question. I know there's another one I'm missing. Cody's asking, how are these tests taken? These are mostly blood draws, and I think you're talking about the Cleveland Heart. The Cleveland Heart panel is a blood draw. Doc, correct me if I'm wrong. It just kind of depends on the test.
Yeah, I assume you're talking about the Cleveland. It's a blood draw. Quest Labs does them. They file your insurance. They send it up to Cleveland Clinic. I guess that's what you're talking about.
Motaz is asking, if I'm not near any of our offices, can I still get a Cleveland panel through you guys?
You can. Okay. Just contact the office and I will mail you, or fax, or whatever you do these days, an order sheet for it. And you can go to any Quest lab and they'll send me the results, and then we can go over by phone.
All right. Thank you for that. Motaz, let's get to Deb real quick. Melatonin and magnesium okay for daytime use. Nightmares when take at bedtime with 81 milligram aspirin.
Yes, you certainly can. You can use either of those at nighttime. Again, unless there's a dark room, even with high doses of melatonin, it's not going to put you to sleep. I have people that take incredible amounts of melatonin during the day for other reasons than sleep. Melatonin's, has a lot of different positive things that it does, but I have one guy who takes 150 milligrams of it every day. I mean, that's a high dose.
That's a high dose.
Read Dr. Schallenberger's stuff on it. He's a well-known guy that is a huge believer in higher doses of melatonin, but it doesn't make you sleepy unless there's a dark room. And certainly I have people that take magnesium at different times of the day, and they seem to do fine with it.
Jordan's asking, Jordan just lost 45 pounds on Ozempic. They are asking, what's the average weight loss? Which is a great question. And congrats,
Man.
Jordan. Like I said earlier, that's amazing.
That is way above average. Let's put it that way.
Yep.
It just depends on the dose. I think your average, if you read the literature, and then they don't push it much, but it's probably between 12 and 16 pounds. But, that's awesome. I had a guy today that I had seen from out of town. He's down 80 pounds off all his medications. I also put him on some testosterone. Feels and looks like a different person. Very happy.
Thank you for that, Jordan. Congratulations on the weight loss. That's amazing. Margaret's asking, Dr. R, are there certain days that you're in the JC office? Katie and Carter probably know this better than you do, but
yeah, occasionally I'm there on a Thursday or a Friday. If you can't, get in to see me, sometimes I'll do that. So contact Katie about that schedule. Same thing in Knoxville. Same thing with the Knoxville offices.
I think we so Cody's asking for low E and low T. I think that's with the in regards to the testing. That would still be a blood draw.
Yeah, I mean we can do salivary test, but we usually prefer, especially for those two, the blood draw.
Yeah, I think we got through all the questions. If I miss one, I am so sorry. Jordan's asking for an encore, and I just, to be honest with you, I don't have time.
He hears me play all the time.
Jordan, we'll get more of that.
Stairway to Heaven. I'm going to work on a song. I am working on a new Led Zeppelin song.
And Mama B, I promise you that will be the
Dog.
first question. First question on next week's show will be that one. It's a great question. We'll talk more about the different types of magnesium. Doc, man, is Ike there? We're gonna call it a show, man.
Yeah, here is Ike. Yeah, come here, Ike. Come here. He's getting heavy. He did get a haircut. You know that. He looks different.
I'm going to put this up for Ike. Maybe Ike knows Mama B's question. Do you have an opinion on Organics Mag 7? Do you know that one?
No, I'll have to look that up. Wow.
Okay.
7 different types. Wow.
So Mama B, I see that we need to look up Organics Mag 7 with 7 different types. So we will check that out. Guys, thank you all so much. Thank you all for hanging out with us tonight. If you're new to the show, this is the Performance Medicine Show. We do this every single Tuesday at 7. Dr. Rogers answers your health and wellness question. And then we got my brother over there, Ike, who joins us at the end of the show to sign us off. Thank you to everyone, to all of our team for all the help tonight. Katie, Carter, Montana, Amber, the whole crew. Thank you all so much. Mom, who made a brief appearance. You want to make another appearance, Mom?
No. No, I don't.
All right. Dave, I love you, man. Thank you so much for the questions. Tanya, thank you. Mark, thank you. We love you guys. Let's see. Karen, thank you. Thank you. We love you back. Robin, we're going to head out. Doc, I love you, man.
Love you.
All right.
Fun.
Thank you, Mom. I'll see you in a bit. Outro. Ike, come on, man. Where's my outro? Where is my outro? I love you guys. We'll see you next week. If I can find it. There we go.
Don't go away.